Thank you, Hope, for sharing your story and for your tremendous advocacy on behalf of the larger community. I have a question for you both. As we've heard from several of the speakers today, there have been a number of challenges related to communicating effectively about these exposures and their potential health effects. I'm wondering what your go-to resources have been for evidence-based information and how that's informed any personal actions that you've taken.
Oh,
go for it, Pat. I'm going to take a breather.
Well, I mentioned the the European Food Safety Authority. I think that is worth a shot. And then also the Stockholm Convention on persistent organic pollutants is an invaluable resource. The Environmental Working Group is, it must be mentioned, and I'd beat myself up if I didn't mention that. Harvard University's School of Public Health is stellar. Northeastern University is excellent. And that probably rounds out the top ones. There are lots of different university studies out there that I have used, and that would require reading them and then sending links. But thanks for that question.
I would just say, like, peer-reviewed articles, the government websites, and I'm going to ditto everything that Pat said. Silent Springs has some great things. We can go on and on. I feel like we have some amazing, EWG is amazing. Environmental justice, there's just a lot. We're lucky to be in this group and be able to share the information with each other.
And some of the personal changes that you've made to prevent and reduce exposures?
Well, I stopped eating seafood. So does my family. But I'm probably the only one in this small neighborhood here. Although there are people in the community who have also stopped eating the seafood. I mean, it's tough. It's a cultural thing for us, my family's been here for 350 years. And so people came to this land and made a go of things because of the oyster, the crabs, and just dozens and dozens of different species of fish. This is a rich land, the Chesapeake, and it just kills it. So that's the change. It's a realization that things are never going to be the same with these forever chemicals, especially with the Navy not being upfront and not releasing test results, and really not coming to the table and not communicating.
So the things that I've done for my family is basically change lifestyle, buy organic food. My two daughters are in college. They both have water filtration systems that are RO on their counter. I will not allow my kids to drink public water from any state because I know the regulations aren't there. I mean, the food we eat, kind of like Pat's saying, the water we drink, the things I buy, the clothing I buy, the furniture I buy, I'm definitely very aware, and it's costly, but aware.
Yeah.
And I see a question from Kevin Elliott, so I'll turn it over to him.
Hi, thank you so much. And thanks to both of the speakers. I appreciate your comments. This is a question, especially for Pat. I appreciated your getting us to think not just about water contamination, but about food. But I do think it potentially makes it more complicated thinking about who to prioritize for blood testing. And we heard from some of our earlier speakers today, emphasizing if you have an affected community where there's contamination, they argued that it's important for those people to have access to blood testing. But if we're thinking more broadly about, say, exposures to seafood, then that raises other questions about how to prioritize who to test, potentially with limited resources. And I just wanted to give you an opportunity to comment if you had thoughts about how to think about these issues.
I appreciate that. We have an Hispanic community here in St. Mary's County, typically at the bottom end of the county, clustered around St. Michael's. But there are several hundred families, and their substance subsistence fishermen, and so are African Americans, and it's a cultural thing. But gosh, it wasn't too long ago, a couple of weeks ago, I was on a fishing pier, and they were starting to catch catfish in the end of March, on the Potomac River, just several hundred yards south of the Indian Head Naval Weapons Testing Center, which has been in use since 1898. What's in the catfish, man? What's in the perch? And, I didn't tell those guys, I just didn't have it in my heart. But to answer your question, it's people that live on fish, first and foremost. And then, of course, just watermen and people in the seafood industry, have the proclivity to consume more of the stuff.
Thanks very much.
Yeah, sure.
Any other questions from our committee members? I see another hand from Chris Wyand.
I'm curious, Pat, the Chesapeake is certainly known for some other contaminant issues over time. And I wonder, has any work been done to try to do a broader assessment to kind of see where PFAS fits in the whole scheme of things? I mean, it seems if you're really looking for sources and trying to connect that data with everything from illness to environmental degradation, there's a need to do that. And I'm wondering, has there been any work to sort of see where PFAS fits? And if ultimately the solution for physicians, the solution for community organizations and so on goes beyond water and food per se, but really goes back to some of the other mechanisms or some of the other contaminants that may create a greater risk, and to try to tease that apart.
Well, certainly there's been robust study documenting PCBs and mercury, as there has been pretty much everywhere across the country. And our fish advisories in the state of Maryland pretty much focus on those two types of contaminants. The Chesapeake Bay Foundation has not been forthcoming on PFAS. In fact, they issued their annual or biannual Chesapeake Bay report card and gave the Chesapeake blue crab a B+. And that's, after I sent them data showing that, they're contaminated with PFAS. So the message hasn't gotten across to them. But your point's really well taken. We have to look at this as part and parcel of a larger problem.
Hope, I wonder, sort of along the same lines, when you deal with the physicians and the medical community, you talk about the lack of awareness in a lot of cases of PFAS-related issues, but does the medical community kind of look at that big picture and try to put these things together, or is there a general lack of understanding? You think of potential environmental contaminants that may result in adverse effects.
I think it's they want to look the other way. That's how I feel, because they don't understand. It's a lack of knowledge. I don't see any knowledge in any physicians in our local community. The only first time that I recently just heard from a community member, she was at Penn and she had non-Hodgkin's and she's 20 years old, and just so happens she was on the same floor that unfortunately 3 other people were on from her neighborhood who all had cancer, and he connected the dots by their addresses and said, I think you might have an environmental poisoning. And but yeah, that's the first time I've heard that asked. And but locally, no, there's a lack of understanding and I think knowledge, and it's hard. I mean, we even tried calling, because we're a part of the MSS study, the national study as well, and we've tried to get physicians onto our CAP to pull them in so we can help them, they can help us. We had no participation from any physicians in the local area, and we're a pretty big area. I mean, there's over 85,000 community members, and it's 4 different zip codes. So that's alarming and scary and sad that nobody knows.
Thanks.
I also want to add my thanks to both Hope and to Pat, and of course to Mida for this session. Very useful information, highlighted some different points, helped move us forward in the information today. So thank you for your time and sharing your information and your stories today.